What you're going to need to do is take some large dissecting scissors, and we need to fracture the mandibular symphysis. So take the scissors and place them between the canines, press down, and then I usually will take my hand and squeeze on the ring handles so you get more force behind it. And we have to squeeze and let go and squeeze and let go. It might take a couple of you, but eventually it'll snap. Okay? You're then basically going to cut the tongue away from the sides of the neck. So you're going to take the scissors and you're going to start in the mouth and cut on each side to remove the tongue from the muscle attachment, and then eventually you'll be able to just squeeze the tongue through. You're going to continue.
Oh, it's cool.
Then you're going to continue cutting on each side of the neck until you can stretch the tongue all the way back and reveal the larynx.
Oh my god, how far.
So if you can't see this, you haven't cut far enough. Keep on going. Okay? So let's review the compartments. We remember that this is the hard palate, correct? And then this would be the soft palate, which you can now see. The hard palate has that what looks like rugae, right? Soft palate is smooth. The back of the throat is known as the pharynx, and in the pharynx are your tonsils and the opening to your esophagus, etc. So that's the pharynx. There's a hole in the back of the pharynx. I can put my tweezers in, and it goes into the nasal cavity. That's known as the nasopharynx. Yep. Okay, so that's basically what postnasal drip comes from when you get sick, right? You get a sore throat because all of the sinus debris is dripping into the back of the throat, into the pharynx from the nasopharynx. And then the larynx includes the opening into the trachea. So the larynx are the structures, the cartilaginous structures, which open down into the trachea. So make sure you're comfortable with knowing the difference between the pharynx and the larynx. Okay? The reason this is so important is because when we place endotracheal tubes during surgery, this is where we're going, right? We want to be able to see the larynx so we can pass the tube down into the trachea. So use the book. It's really handy as far as pictures. The first structure you want to find is the easiest to see is this flap right here, cartilaginous flap known as the epiglottis. Epi means above, so that means there must be a glottis somewhere, right? So epiglottis covers the hole to the trachea. The hole to the trachea is known as the glottis. Okay, so I can put my tweezers right in that little hole, and it actually is leading to the trachea.
Wow. And that's the glottis?
That's the glottis. So the glottis is just a hole. It's a space. Sometimes called the laryngeal opening.
The glottis?
It's just a space. Opens to the trachea. Now you can see if I fold down this epiglottis, it completely covers the glottis, and so your body naturally closes that structure when you swallow to prevent you from aspirating your food and your water. What's controlling the opening and closing of the glottis is called the vocal cords. So there's soft tissue, so make sure that you note that the vocal cords are soft tissue, and they're attached below the epiglottis, and attached to the vocal cords are a little tiny pair of hard cartilaginous discs. And these are called the arytenoid cartilages. So the arytenoid cartilages are attached to the vocal cords, and they help control the opening and closing of the glottis.
Okay, so where's the vocal cords?
These very thin, so if you look right here, vocal cords are the very thin pieces that are attached below the epiglottis, and they actually make up the whole, like they're the two sides of the whole of the glottis.
And then the
arytenoid cartilages are attached to that too. The whole thing makes up the whole. Okay. Basically, the arytenoid cartilages just give integrity to the whole, right? Because if it was just soft tissue, it would just flap there. And those cartilages allow it to have structure.
So both of them together move the...
Correct, yes. Okay, so now just gently put the tongue back in the mouth. And you're going to move down into the neck. And right now you have sternohyoideus muscle over the neck here, and some of the digastric and mylohyoideus muscle. And you're going to have to take your scissors and just destroy the muscle, because we need to see the structures of the larynx underneath. So if you haven't had an opportunity to take a picture of this, make sure that you have done that. And then you're going to look for the hyoid bones. And those are those floating bones, the butterfly bones that are in your neck. And that's what contributes to that Adam's apple, right, that especially men have. And the hardest dissection today is the hyoid bone because the muscle is so tightly adhered to it. So you just take and rip off around it, and you look for white that looks like a butterfly. Okay? And that's the hyoid bones. We're then going to move caudal down the body, and we have the thyroid cartilage, which is next. Thyroid cartilage. And then just under that is called the cricoid cartilage. So if we go from head to tail, if we're looking cranial to caudal, it goes hyoid cartilage is first, and then thyroid cartilage is second, and the last cartilage is the cricoid cartilage before you get to the trachea itself. Okay? The thyroid glands are on each side of the thyroid cartilage. So you're going to just take some tweezers and kind of have to open up near the common carotid artery, and you see one gland here. See this big gland?
Oh, wow.
And here's the other one on the other side, right here. Okay? Literally just lateral to the thyroid cartilage. Everybody knows the diaphragm, right? We have that. You're going to take a scalpel blade and you're going to make a cut right into the trachea. And you're going to open it up, and you're going to see a muscle at the back of the trachea. That's called the trachealis muscle, which allows for expansion of the trachea. It gives it some flexibility. And then the top part of the trachea, which you can palpate on your own neck, is made up of tracheal rings, right? That's cartilaginous rings. So there is no trachea on your list. You see that it's separated into the tracheal rings and the trachealis muscle. Last thing you're going to do is you're going to take some scissors and you're going to follow that trachea down underneath the great vessels. You're going to take some scissors and you're going to cut the vena cava and those pulmonary arteries and veins, and you're going to reveal underneath the trachea. You're going to take some tweezers and you're going to pull out all of the fat and fascia that's in between. You're going to look for where the trachea splits. And where it splits is called the carina, or the bifurcation of the trachea. And that split leads to two primary bronchi, one on the left and one on the right. Okay, primary bronchi, we have left and right. And those primary bronchi split again into multiple secondary bronchi, which are going directly into the lung lobes. Okay. And then we have the lung tissue itself. We don't call it lung tissue, we're going to call it pulmonary parenchyma, which just basically means lung tissue. Okay. We have the covering over the thoracic wall. It's called the parietal pleura. So it's consistent with the terms that we've used as far as wall coverings are parietal, right? So parietal pleura. And over the organs is called the visceral pleura. And then the last bit is on the tongue. And for some of you, you're going to see blue vein on your tongue. Your lingual veins be very prominent. Mine's a little hard to see. You can see off to the side here. See red and blue, my lingual artery and lingual vein on there. Okay. And that's it.